I anticipate that potentially we won't even see coverage in some parts of the country in the individual market because insurance companies will be like, I can't price here. But at some point, this is all going to break, and you don't want to be waiting until it breaks to help your employees figure out what's next.
Healthcare in America isn't just complex, it's chaos, with the information and power stacked against employers and patients. On Margin of Care, we set out to rebalance that scale. Today, we are thrilled to be joined by former CDC Director Mandy Cohen, and wow, she is impressive. Dr. Cohen earned a medical degree from Yale and a degree in public health from Harvard, both within a year of each other. I'm not even sure how you do that. She went on to study internal medicine at Mass General before taking on a deputy director role at the VA. From there, she became the chief of staff for the Centers for Medicare and Medicaid, where, among other things, she appeared before Congress to advocate for maternity coverage as part of the ACA, while 8 months pregnant. Mandy served as the health secretary for the state of North Carolina from 2017 to 2022, overseeing a complete overhaul of the state's Medicaid and managing the state's COVID response under a politically divided state government, all while somehow increasing public trust in state health institutions. And oh yeah, then she ran the CDC. There are few people in the world more qualified to talk about public health and how massive policy shifts will affect employers. Dr. Cohen brings a blend of deep knowledge and real-world pragmatism that is truly refreshing. Stay tuned, guys. This is a good one. Well, Mandy, it is so incredible to be joined by you here today in beautiful Park City. I remember back during the pandemic, I was seeing you on TV. I was wondering, what is ever going to happen as we get out of this sort of COVID crisis mess? How are things going to change? What are some of the things that you've actually seen change for the better as it relates to access and quality of care within the U.S.?
Well, first, great to be here. I know we are in a tough moment. There's a lot happening in healthcare that feels like a storm, a tsunami sort of coming that we can see and we're experiencing. But I see every crisis as an opportunity to get creative and do something different. And I love that we're starting with a question about what good things came out of the pandemic, because I do think that there were good things that came out of there. Now, I want to start with some of the partnerships that came out of the pandemic. I saw folks working together in the healthcare ecosystem in ways during the pandemic that they'd never done. Competitors that were sitting side by side to solve a problem. And I actually think that has helped them move forward in this moment. So I saw hospital systems working together. I saw payers working together, and frankly, all of the above to solve real problems. And actually, I see a lot more of that collaborative spirit coming out, which is great.
Than pre-pandemic, where they were competitors and had the fists up.
Yeah, and where it was a lot more of, I'm going to hoard my data to compete with you so that we, as opposed to now where we're going to still compete. Look, we're still businesses. We need to win. But the way in which they are competing feels different, and more acknowledgement that folks are going to multiple places, that we have to share more data. So and that we can't all do this alone. We're in such a complex ecosystem in healthcare that we need to partner. And I'm seeing a lot more partners, particularly in the virtual care space. I see more collaboration. So that's one. Second, if you think about the policies that needed to change during COVID, that I think we've seen continue, and I hope will continue, I think telehealth was by far the most important policy change that we saw. During the emergency, we all used our emergency powers to say, yep, do telehealth. We're going to be staying home, figure out virtual care. And folks who maybe were sitting on the sidelines thinking about virtual care for a really long time were like, oh, I got to figure this out in 2 weeks.
We don't have a choice now. Yeah, it accelerated this issue. Yeah.
I got to figure this out in 2 weeks. Right. So now I think that is great for patients in terms of access. I'll just give a personal anecdote. My mom, unfortunately, is fighting pancreatic cancer. I don't live in the same state she does, but I'm able to join all of her visits because they're virtual. So I can join and hear what the oncologists need to say from a customer patient experience. I think that's wonderful. And it's what you're seeing. We've continued those telehealth policies to allow for that flexibility. But I think those have been really important innovations so that we can expand access and allow folks to really think differently about where they're going to get their care. The other thing I would say is that is unsexy, but data systems got a lot better during COVID. When I was leading in North Carolina, one of the very first things I had to do, we called it kill the fax. We were still using fax machines to get lab data. Mm-hmm. It was bananas. And so we had to rip out and replace a lot of data systems and make real important changes. And frankly, COVID funding allowed us to do that. So that's great. And then maybe the last is we learned so much about how to communicate, sometimes by doing it wrong. And so that we are thinking differently about in this moment of a changing communication ecosystem, how do we reach people? How do we change behavior? How do we build trust? Those are certainly lessons I learned through the pandemic. So I think all those together, right, you have sort of this collaboration, you have really new technology and policies that allow you to do it. You have data systems that allow for more transparency in what's going on. And then you think about communicating differently. That's big sea changes for our industry.
One of the other things that I felt really moved the needle, I'm curious to kind of get your take on it as it relates to, sort of the pandemic sort of forcing and accelerating the focus area, is just around the idea of mental health. I mean, so many people struggled, whether it was with loneliness or depression or any number of challenges that really were amplified during the pandemic. As you sort of think about coming out of the pandemic and where we are right now, how do you feel about sort of the nation as a whole and the healthcare industry as a whole managing the mental health crisis that's in America right now too?
Yeah, I think we have been destigmatizing mental health in an important way, whether it's we mainstream like couples therapy that we all watch, or the fact that we've made it so accessible for people to get mental health. I think part of it was culturally, we didn't talk about mental health as much, but we've just hit a crisis point. One of my priorities as CDC director was on integrating mental health, and it was particularly because we still lose more people to suicide, right, than we absolutely should. And so there's really, really important work that we've done in the last number of years, whether it was putting 988 in place and just understanding what was driving those trends. And of course, it doesn't hurt that we had underlying policy changes to make sure that we had parity in what we paid for in mental health. I will just speak from a North Carolina perspective. We spend a lot of time in our Medicaid space putting together physical and mental health because they should not be separated. They absolutely should not be separated. But you can't just snap your fingers and make that true, right? So it's like a lot of policy changes, a lot of communication, a lot of different ways of thinking. This was not necessarily accelerated by the pandemic. I saw this work actually start back in the VA, in the Veterans Administration. I actually think they were the first ones that recognized in soldiers were coming back, had PTSD, had a lot of mental health challenges. And I was a doc at the VA, and they embedded behavioral health right into primary care. So they were real pioneers in that. And then we saw that move through the rest of the health ecosystem. So I want to give a shout out to they were on the front end of
the front ends of integrating the two things together. That's incredible. One of the accolades that we were talking about earlier as we were introducing you was the Tar Heel of the Year accolade. And you were on TV a whole bunch during the public health crisis with the pandemic. I am curious, as you sort of look back right now, how do you feel our overall preparedness is for the next public health emergency right now?
Ooh, that's a big question. So, all right, you only have the system you have when you go into these crises. So yes, we had not had that kind of historic and immensely large kind of crisis in 100 years, luckily. And I hope it'll be that long again. But I will just say, with a globalized world, right, where we are a plane flight away from where really bad viruses or bugs could come from, that I think we are going to see more pandemics in our future if we don't stay ahead of them. But in terms of preparedness, let me give you the answer of where I thought we were in January of this year, again, under my tenure. So that's what I know the most. I thought we were in a better place, but we had a lot of work to do, meaning that we had better data, like dorky things like data infrastructure, response capability. I mean, we changed completely the way that CDC operated. I think we all learned really important lessons about communication and thinking about treatment and diagnostics and really being prioritized about what pathogens do we think are really going to cause those next pandemics. So I thought we were on a good track, but I will still say that being so close to the pandemic, I don't think we've had a full reckoning of what we learned and what would we do differently next time. And it's become so partisan, and so there's so much distrust that has been sowed there. I think everyone has some amnesia about the whole experience.
I was thinking that myself too. Like, it feels like it was so long ago, and it almost feels like a lot of people like decided to forget.
Yeah.
Right.
Yeah. And I appreciate that. That is like probably healthy coping mechanisms. So speaking of mental health, but I think we forget how hard it was in March of 2020 when, one, we didn't understand this virus in terms of who did it impact, how bad was it going to be, and we had zero tools. I have to just keep reminding folks of this. We didn't have any tests. I did not know who had COVID, and we couldn't help people identify that, let alone no treatment, no vaccines, no protective equipment, even for healthcare providers, let alone individuals. So we say, oh, we shouldn't have done X, Y, or Z things. Well, that's super easy to sit here now, knowing we have so much more information, we have so many more tools. If we had all of that back in March of 20, of course we would have made different decisions, but we learned. We don't have to have, we don't have to be caught flat-footed. We can have systems that pick up pathogens more quickly. For example, in wastewater, this is like the thing we put in and I think is a really important innovation. Right now, we basically wait for someone to get sick, come to the emergency room and swab a nose and try and look at what viruses they might have. Looking at wastewater, we don't need anyone to do anything. We can actually take samples from poop, everyone. We can take samples from the wastewater and know what pathogens might be in there. So it allows us to stay ahead.
More predictive at that point.
Exactly. Yeah. So before someone gets sick, we can see things ahead of time, but we also need to see those things internationally. And this is when, the heart of your question of like, are we prepared? I am very concerned this year that we have walked away from our investments in global health. Mm-hmm. I'm worried about what's happening domestically, but I think to keep our nation safe from the next pandemic, I actually think that's going to come from outside our borders, just like it did with COVID, happened in China. I think we need to keep up that investment in global health. And you've seen, we are obviously not making that investment and making that policy choice. And I think that is going to come back to bite us. Now, it might not be in 2 months or 2 years, but we're going to see that come back to haunt us. And I'm very concerned about us not having eyes all over the world to be able to identify and hopefully stop something at its source.
But I think it comes back to, you were mentioning too, how the pandemic sort of forced, adversaries to come together and sit at the table together, hospitals being at the table with one another, insurance companies being at the table with one another. I think countries making sure they have a plan together at this point too. Yeah. I want to just maybe shift gears a little bit and think about what's one policy shift at the federal level, at the state level, that employers should be watching closely within the next year to 18 months.
Yeah, the headlines have really talked a lot about HR 1 or the big, beautiful bill and its impact on Medicaid. So I think that's in the ether and folks understand, there are going to be some folks who probably are going to be kicked out of Medicaid if they don't meet the work requirements or the paperwork requirements. There's going to be less money in the Medicaid system. And we all know that if you squeeze the balloon somewhere in healthcare, it pops out somewhere else. So we know if hospitals feel strained on Medicaid, there's going to be some cost shifting to the employer market. I think folks are aware of that. The thing I want them to be aware of is what's happening in the individual market, in the marketplace. And it's why the government is shut down right now. So Democrats would like to see the tax credits extended. We've all now seen the price increases that are coming in the marketplace. And what happens when you see these major jumps in prices in the individual market, it means it's going to change the risk pool. If you're younger, if you're healthier, you're going to really think twice about, wow, the price of that just doubled for me. Felt like a strain before. I don't know if double is going to be for me. So you're going to see younger, healthy folks leave the risk pool. But for sure, if you're going through cancer treatment, you're staying in. And I am very worried about the health of the risk pool. And then there's some additional policies that are coming in the next couple of years. They change the way you would renew your plan in the marketplace. They want you to come back and verify and press the button yet again to renew. And, just as someone who was personally very bad at paperwork in my own life, right, that is going to be an adverse selection problem again. Yep. If you really need your insurance, you're going to be there to re-enroll. If that's not something that's top of mind to you, you may miss those deadlines. And again, I am worried about what that means for the risk pool going forward. And again, when you see a strain in a part of the healthcare ecosystem, so if you see strain in the individual market, or if we lose folks, or the prices, or folks misprice and then have to make it up somewhere else, that is going to have real important trickle effects onto the employer market.
Yeah, I saw one of the statistics. I know there's a lot of them out right now. I think the average ACA premium is increasing by 26% for 2026 right now.
That's including the tax credits, if the tax credits increase. So if they don't actually get to a place where tax credits increase, I think the price increases is something more like 67%.
So thank you for clarifying that. So one of the things that, we know a number of employers might at least be dipping their toes in the water with right now and exploring, at least having exploratory conversations, is this concept of kind of de-risking themselves and saying, hey, we kind of want to get out of this world where we're managing benefits on a day-to-day basis. Let's sort of transfer that to this whole ICRA world right now. And, we're going to allow our employees to access some stipend that we're going to provide a defined contribution, if you will. And we're going to let them partner with an ICRA vendor and go shop for care, the type of coverage that they want through the individual marketplace. What type of experience do you think those types of consumers or those types of employers who actually decided we're going to implement ICRAs, what are they going to be facing here within the next year or two?
Yeah, the unfortunate thing here is they need a healthy risk market. They need a healthy individual market in order for a defined contribution to matter, right? So what I anticipate is that we're going to continue to see price goes up, which then means that the risk pool changes so that the prices go up, and then the risk pool changes the price, right? We're in the not great part of that spiral. I anticipate that potentially we won't even see coverage in some parts of the country in the individual market. So there won't even be options for folks, because insurance companies will be like, I can't price here. So one, it might not be there for you at all. Second, it will be at a higher price than you were hoping your defined contribution could cover. I think this is exactly why employers need to understand and be at the table for these healthcare conversations. And we've all been to every conference. Costs are going up. Why is today different, right? And
every year is unprecedented.
Yeah,
right?
but at some point this is all going to break, and you don't want to be waiting until it breaks to help your employees figure out what's next. And I think that's the point here. I understand the sentiment of wanting consumers to have options and put the power in their hand, but you need a functioning market in order for that to happen. And this is why employers need to understand what's happening underneath it and talk to their members of Congress about how do we make sure we are crafting a sustainable individual market.
We have a few instances that we've heard over the last couple of months where smaller fully insured groups, one saw like a plus 118. So, I mean, there are employers that are in these dire circumstances where like truly this is an existential crisis that they have. Like in order to avoid layoffs, in order to avoid potentially shutting down entirely, they have to have some of these other levers to pull, which in some cases might be ICRA. So we know that for 2026, a lot of the different consulting houses are forecasting a 10% trend going into 26. If you could just unpack a little bit about what you're seeing as some of the major cost triggers that employers and their advisors should be thinking about that might not be so obvious to them, at the end of 2025, that are going to really start impacting employer plan trend into 27, 28 and beyond.
Look, I'm a huge fan of AI. I think it's doing some incredible things in the healthcare ecosystem. But one of the things it is not doing right now is saving money. And I think we make an assumption, if it's AI, that means less humans, less capital costs for, oh, great. Hold on. Let's back it up here. Start with the fact that these AI investments are not cheap. So payers are investing, providers are investing, and they're going to want to defer some of those costs elsewhere. So that's number one, that these are just costly investments and they're going to want to recoup. But what I'm really seeing is this, what I'm calling like this arms race between payers and providers, meaning that payers are using AI in their systems to get better at making sure they are getting their value for their money with their providers, meaning that they're using AI to say, is everything that you build actually the appropriately coded? And maybe I think it shouldn't have been a level 5 visit. It actually is a level 3 visit, and I'm only going to pay you for a 3 instead of a 5. And at the same time, providers are saying, oh, no, I want to get more money from the payers, and I want to make sure that I can extract those dollars. And so what happens is it's almost like grasping for those same dollars. And I don't actually see that saving money for the larger ecosystem, right, of healthcare or for employers. So I'm excited about some of the tools in terms of ways for folks to have access to care potentially as we go forward, and using AI to help answer questions and maybe triage. So it's not all negative. It's just, I do not think in the next 5 years is when we're going to see cost savings from AI. And if anything, it's going to drive costs up first, because all of the change management costs and the investment costs that go into it, plus this arms race, we're really in the back end. So just my advice to folks is to be thinking about it and to price that into what you are thinking in terms of cost increases for the next number of years.
Healthcare tends to sort of move mountains in times of crisis. So could you foresee any big changes as a result of the healthcare cost crisis that might be relevant for employers?
Such a great question, because we see the platform is burning and it feels real hot right now. There's a lot happening. And I think we are in a moment where we're just pushing to high deductible plan. That's just not going to cut it anymore. And there are new tools, and that is great to take advantage of. But I do think it is going to take a mindset shift for employers that this probably isn't going to be something you can confine to your benefits folks alone. This is actually about a culture of health within an employer organization. And I say that because in order to get past this cost crisis moment and really try to bend the cost curve, you're going to need to engage your employees, foundationally. And you can't just come to them to be like, oh, we got a new plan, you got to do this new thing or that. You got to have to show folks that you care about them and their health. And employers do care about, obviously, they're investing in their employees. And I think you can show that through not just, here's your benefits, we talk about that once a year or on onboarding and never again. But how do you create that culture of health? Because I do think it's going to be harder. There's no one solution that's going to fix the cost crisis. And that's going to be hard. So when you have multiple solutions that need to be implemented, probably all together in some way, whether it's encouraging primary care access, managing chronic disease, managing specialty pharmacy, integrating behavioral health, those are all hard things to do for employers, but I think that they won't be successful at all of them unless they are actually engaging their employees and building some trust around that, particularly at a moment where trust has eroded. And as the former CDC director, I'm seeing that play out dramatically, unfortunately, for in the space that I know well. I think employers are trusted, sit in this very important and unique space. So I'm really excited about employers leaning in this moment. And it can be everything from, we want you to be healthy, here's a flu shot clinic, to we want you to be healthy, learn about menopause. And here are some benefits that reflect us caring about where you are in this moment. There are a number of studies now that show that employees trust employers in terms of health information, because that's where they get their benefits. So that's great. So I would use that to help folks make good decisions about where to get their care at the right time, in the right place, or in the right setting. And yes, it is going to be harder than letting that be someone else's problem. This is going to take some leadership from employers, and using some of the great new tools that exist out there. But it's necessary for employers to engage at this moment in order to drive change across the health ecosystem.
So I think one of the harder things that employers tend to grapple with, and consultants tend to grapple with it too, is the concept of behavior change, getting employees to do what we need them to do to make better decisions. And I guess I would be curious, Mandy, from your perspective, how do you think about how employers can actually incentivize employees to do the things that we need them to do, whether that's vaccinations or going to get better care from better doctors within the network, and not just relying on maybe their neighbor's recommendations, or just going to the doctor that they've seen their entire lives because that's just what they do.
Yeah.
What guidance would you provide?
Yeah. So foundationally, I think about change and trust being interlinked. And I did not say it first, but I say often change happens at the pace of trust. Some folks think that fear changes folks. They're trying that out at the federal level. I do not think that's how you get long-term results. You can get some short-term results. So you can scare people into changing. But it turns out you actually need to scare them very often in order to do that. And then, wow, you're in a scary place all the time. Yes. So instead, you want to create a shared vision for the future. I mean, I think this is what every business class teaches you about good leadership. You want a shared vision of the future, and then break down for folks, okay, here's the steps we're going to take to get there. And it takes role modeling from senior leaders to do it. So you can't expect your employees to do something different that the C-suite is not willing to do for themselves. So if you're not role modeling getting your flu shot, or taking advantage of some mental health benefits, or accessing, online primary care service, or whatever it is, role modeling that, and then continually articulated, we're doing this not for punitive, not for bottom line. We care about you and your family's health, and we're in this together. And let's figure it out together, right? And start fundamentally there. And it doesn't mean we're going to change all the things overnight, but how do you build trust? Transparency. I want to be transparent. The costs are going up here. This is really hard for us. We want to be able to maintain as much of the flexibility that you have now, and we want to prioritize that. In order to do that, we have to do some things differently. Here's some new tools we want to take advantage of. But it comes from a place of, we're on the same team, right? We care. And again, I think that is the winning strategy if you want to retain your employees, if you want to meet your goal. And so I think employers know this inherently, but they haven't made health part of that. And I just think the imperative now is that they need to.
Mandy, thank you so much for being here with us today. I know our listeners are going to walk away with a lot to think about, but in terms of just your really extremely well-rounded point of view on public health, on policy, on innovation, super, super valuable. So thanks so much for being here.
My pleasure. So a lot going on, but every crisis has an opportunity, and it's a matter of taking advantage of this in service of health. So happy to be here.
If you're liking the conversation, be sure to subscribe so you don't miss future episodes. And if you've been enjoying Margin of Care, please leave us a review on Apple, Spotify, or wherever you listen. If you've got feedback or questions or something you'd like us to cover on the show, send us a note anytime at marginofcare@getgarner.com. We'd love to hear from you.